Good evening everyone and welcome to SA Health's live Q&A on vaccines. And it's really a pleasure to be here this evening and hopefully we can provide some answers to all of the questions that people have submitted. Thank you very much to the audience for sending in some great questions. So I'm Professor Nicola Spurrier, I'm the Chief Public Health Officer, and I'm really pleased to be joined this evening by our Chief Medical Officer, Dr. Mike Cusack, Dr. Mike, and also I'm really delighted to have Dr. Pravin Hissaria. Pravin is our clinical immunologist and also the medical director of COVID vaccination at Central Adelaide Local Health Network. A lot of expertise here tonight, and hopefully we can give you some concrete answers to some of those tricky questions we've been asked. So let's just start straight away, and I will fire these questions at both of you, and there's a few that I would like to attempt to answer as well. First up, one for you, Mike, and this is a question from Don. And Don is wanting to know when are nursing home residents in South Australia going to be vaccinated and which vaccine is going to be used?
So thanks, Don. Aged care residents are part of the 1A phase of the rollout, which is underway at the moment. Now, the Commonwealth Government is responsible for aged care in terms of rolling out, though there are a few state-run aged care beds. And as I say, the rollout is proceeding as we speak, and in terms of Commonwealth is for the most part done, and in terms of the state programme has been completed already. There are still though some staff who are being picked up, and in terms of the vaccine itself, it's the Pfizer vaccine, and the reason why that's important is because this is a highly vulnerable group, and it's really important that we get as much protection for that group as fast as possible.
And I think that's because there's only 3 weeks between the dosages for the first and second doses for the Pfizer vaccine. Yeah. So it wasn't because there was anything special about being elderly and needing to have Pfizer. It was actually because we wanted to really quickly protect the most vulnerable people.
That's right.
Mm-hmm. Thank you. Now, got a question from Catherine, and I think this is a good one also for you, Mike. How long does the vaccine work for?
So it's a little bit too early to say at the moment, and I mean, we're clearly fortunate in Australia that other countries have proceeded in advance of us, and we've been able to sort of learn the lessons of the vaccination programs there as they've gone. But the first person who's had vaccine has only really had it sort of in the last 6 or 8 months or so. What we can certainly say is that the vaccines, all of the vaccines available at the moment, give a really strong immune response. So if you're vaccinated, you will be protected. We can certainly say that for the period of time, let's say 6 months as a minimum, that you get a really strong effect. We would assume that it will last a lot longer than that, but it's going to be a thing which our researchers are going to keep looking at over time. So it could be 1 year, it could be 10 years.
Yes, and importantly really for our whole community, we all need to get our vaccine as soon as possible because we could have an outbreak at any time and we really want to have everybody protected.
That's right.
Yeah. Mm-hmm. Thank you. Now a question, thank you, from Vicky, and this one I think is a good one for you, Pravin. Can people who have had a heart attack and are on blood thinners have Astrazeneca?
A short answer would be yes, most certainly. Everyone should get vaccinated as soon as possible. The only absolute contraindication for receiving this vaccine, one is age, obviously, which we know that under 50, Pfizer is the preferred one. And if they have a history of this very rare venous thrombosis side effect. Heart attack is an arterial event which has not been shown to be in any ways associated with this vaccine. And blood thinners they're not required. They are not a contraindication, except that you just have to press on the injection site a bit longer so that you don't get a bruise.
Excellent. So the only real concern is just a bit of bruising if you're on a blood thinner, but put a bit of extra pressure on, and as long as the person who's doing the vaccine knows about it, they'll be able to assist with that. So yeah, excellent. Thank you. And there are a few questions along the same lines, and so we'll go over that, the particular contraindications a little bit later. Yeah. So another one here from Chris. This is for you, Pravin. Does taking aspirin before or after the vaccine help with the risk of blood clots for AstraZeneca?
Yeah, so the short answer again is no. It's not recommended and it's not likely to do anything. And in general, actually, although cardiologists would like to believe it should be in therm water and it can prevent heart attacks, most of the long clinical trials have not shown any benefit of taking aspirin. unless you have 3 or 4 other risk factors which are very strong, you cannot take aspirin and then heart attack can be prevented. It is only in condition with everything else. So I don't think there is any prophylactic role for taking this medicine to prevent clots. And the mechanism is very different with this particular vaccine and this very rare side effect anyway.
And that leads really well on to the next question from Rob. And this is quite a tricky thing to explain, but I'm going to ask Mike to do this. What is thrombosis with thrombocytopenia syndrome? Can you explain exactly what it is? Because, we've got other forms of blood clots, but this is different, isn't it?
That's exactly right. I'll start with the name perhaps. So thrombosis means blood clots. So the person would have blood clots in their circulation. And thrombocytopenia means low platelets. Now platelets are little fragments of cells which are in our blood. They're really important in the blood in that they immediately rush to sites where there's a sort of little cut or something in a blood vessel and they stop the bleeding. So they form little blood clots at that site. Now what we're seeing with TTS is that people have at the same time blood clots, but also at the same time low platelet levels, which might actually cause them to be at risk of bleeding. So TTS, when it's been observed in Australia, has occurred somewhere between 4 and 28 days after the dose of vaccine. And unlike, as Pravin says, it's not like other blood clotting abnormalities. Unlike the normal places where you might get a blood clot in your deep veins in your legs or potentially as a pulmonary embolism in your lung, we're seeing these blood clots in the cerebral sinuses in the brain, which are the veins inside of the brain, and also rarely in blood vessels inside of the abdomen, in the blood vessels of the kidney, the veins of the kidney, the spleen, or in veins that are draining blood away from the liver or from the intestine. Now it's really unusual to get blood clots in those places. And we're seeing that people, when they have this condition, they'll potentially get spontaneous bruising. They might get little spots of bleeding under the skin for no apparent reason. And in particular, I suppose the real warning sign symptoms are headache, which lasts for 4 days as a minimum, doesn't go away with straightforward painkillers, blurred vision, problems with speech, and if they've got abdominal problems, they may get pain in their stomach, in their abdomen.
Well, that's a lot to take in, really.
Yeah, sorry, long answer.
That being said, it's a very rare complication. I think we're estimating about 6 per million doses for Astrazeneca. So it is very rare, whereas other forms of blood clot are quite common in our community. And I also just wanted to make the point that we think the mechanism, as Pravin had said before, is quite different to the standard blood clots. I don't want to say garden variety blood clots, but the TTS seems to have a different mechanism, and it's thought to be likely due to an autoantibody, so an antibody that somebody's body produces towards a little protein inside the platelet that then activates the platelet, and it's a new syndrome in a sense, because it's something that we wouldn't normally see, and as I said, it's incredibly rare.
That's right. I mean, I suppose just to follow that, the only similar thing that has been described is this sort of reaction that occurs really rarely after heparin, which is a blood thinner drug. So the first people that identified this said, well, it looks kind of similar to this syndrome called HIT, or heparin-induced thrombocytopenia. It was on the back of that they worked out what this problem was.
Yeah. Okay. So the most important thing for people is it's quite different to your normal garden variety, if I can call it that, type of blood clots. Now, following on, because it's very important that people understand about TTS, Tammy's also said, how do people know if they are developing blood clots after a vaccine? So, when would people need to seek medical attention? Could you just run through the symptoms again?
Yeah, indeed, and apologies for the really long answer last go round. Well, for Tammy's reassurance, you will get symptoms after a vaccination that, we talked about feeling a little bit off for a few days, this sort of thing, but these symptoms are much more significant in that the key symptom would be a symptom of headache. Now, you can get this after a vaccine just after a normal vaccination. But this would be a headache that went on for, say, 3 or 4 days and doesn't go away with standard painkillers. Along with that, you might get blurred vision, you might get problems with your speech. It's possible that you could be drowsy, you might have seizures. So a lot of sort of neurological symptoms and serious neurological symptoms. And then alongside that, in that instance, that if you were getting blood clots inside your abdomen, you may get abdominal pain.
Mm-hmm.
I think if these are, if these are serious symptoms and if they're worrying symptoms, you definitely should seek immediate medical attention. Pardon me.
And I think because in Australia we know that we've learned, because this has happened overseas, we've got the foresight to already know about it. So all of the doctors in Australia and people who are vaccinating are very familiar now with this. They've been told about it, and they will inform patients, and you'll be given information, so we can pick these things up early, and therefore get on and treat them. Yeah. And I have another one on this page, sorry, along the same lines about TTS, and this one is from Gary. Sorry, Gary, I've just got your question. What happens to you if you develop TTS? And I think you've talked about the symptoms, but I just wondered if you could talk about the treatment.
Yeah, it's really important. I suppose the key thing is that if you have these symptoms, or if you're worried you have these symptoms, that you get immediate help. I think speed in this instance is important. Where we've been fortunate in Australia again is that we can learn from what treatments have worked and what treatments haven't worked from overseas. And I think it's really key that our clinicians are now very clear on what is effective. So if you have this diagnosis, you will be treated with a blood thinning drug with an anticoagulant, but a specific one which doesn't sort of trigger more of the antibodies to form and to activate the platelets further. And the other treatment that you may have, and this will depend on what your doctors are thinking about at that time, is a treatment which may damp down your immune response. As you said, Nicola, antibodies are really key to this. It's the antibody that's triggering the platelet, and it may be that the immune response has to be just sort of damped down a bit with either steroid drugs or other immune modulating drugs, just to kind of calm things down while the symptoms subsides. I think the important message to take from this is that with early diagnosis and with the right treatment, those kind of headline figures that we have heard of really high mortality is now a fair bit lower, because we're getting pretty good at treating this.
That is really reassuring. And I was looking last night at some of the clinical guidelines, and it was very clear that there were flow diagrams of what needed to be done when, and what tests needed to be done and what treatments were being used, which I think is really reassuring as well. Yeah. Now there's a question here from Bernadette, Jane and Jenny, and this one I think you're off the hook now, Mike. Here was one for Pravin. Does deep vein thrombosis, DVT, increase the risk of clots after having the Astrazeneca vaccine? And I've also had people ask me, does a family history of deep vein thrombosis increase the risk of clots? So
no, as per previous, again, the short answer would be no. As was recently nicely described by Mike. The mechanism of the blood clots which are formed due to this Astrazeneca vaccine is completely different, thankfully very rare, and are not the similar sort of mechanisms which causes blood clots in your DVT. I shouldn't have used the word garden variety, but I won't use it anymore. But they are totally different. So, and hence it's highly unlikely that that this has actually borne out in the closed case studies that have been looked into in Europe as well. So all the cases that have been described so far, none of them had any past history of any of the deep vein thrombosis or any other clotting problems in the people who were affected with it. So thankfully, yeah, that's not a contraindication.
Yeah,
just get the vaccine.
That's really useful information, Pravin, that when they've looked at the big studies internationally, that people who have had TTS have not had a history of DVT. So that's really reassuring. Now, Lorraine, Gail and Nikos have got a very similar question. So are people with a history of blood clots at higher risk of developing blood clots after having AstraZeneca? So not necessarily DVT, but blood clots.
Now, I think, again, same sort of mechanism.
Yeah.
And one thing to add to this is now we have very good treatment guidelines available, and as Mike said, that even if you get this very right side effect, which is not going to be in any ways related to your history of blood clots or deep venous thrombosis or family history, it can be very easily treated. So it's a treatable condition now. It is no more a lethal condition as it was initially described. And lots of that was due to the condition not being described in detail and us not knowing about it. And partially some of the worsening that occurred in those patients was because of the treatment that was carried out to treat that condition, which possibly was not the way to go. Obviously, it was not known then.
Yeah.
So these people are managed slightly differently than anyone else with stroke or a blood clot.
Yeah.
But now we know it, and IVIG, the drug of choice, has now been approved by the federal government and NBA. So it is available here in South Australia in SA pathology, whereby we can get it as an emergency use treatment straight away.
That's good. So it's really important if you, I guess, if you've been vaccinated and you do have a problem, that when you go to your doctor or the emergency department, you tell them that you've had a vaccine so that they're aware that it could possibly be related. Yeah. Okay, excellent.
Yeah, the only thing I would add though is that the headache is very common after vaccine. So unless you have headache with something like a stroke-like feature or pain which you've never experienced before, which is lasting and persistent, then possibly you should, but don't panic either.
Yeah.
Headache is the most common side effect after both of these vaccines.
And I often have had it with the flu vaccine as well.
Yeah.
Okay, now Jane and Christine have a question. In fact, this really leads on well. This one's for you, Mike. Jane and Christine have had their first dose of Astrazeneca. Both have experienced side effects including a bad headache, muscle and joint pain and fatigue for 48 hours following vaccination. Is this normal, and will they have similar side effects after the second dose?
Well, look, it's certainly fairly common. Unfortunately, I think, as we've all said, you can get these symptoms after vaccination. If I can say anything by way of reassurance, it's likely that this is a sign that the immune system is really sort of kicking into action, and these sort of general symptoms, particularly muscle aching and so forth, are just that. So they can be consoled that though they had to suffer a little bit, they will get a really good immune response from this. What we are seeing to some degree is that with second doses, and I mean this is a little anecdotal, but with second doses I think perhaps they're less likely to have this symptom the second time round, but please don't kind of write in and say, sorry, I was ill again the second time. But definitely really important to get that second dose of vaccine. That particularly will give you more protection and longer protection.
I think one important thing about this group of vaccines is, although we are getting higher than expected side effect than, let's say, your flu vaccine or your hepatitis vaccine, but possibly, as Mike rightly said, the higher reactogenicity or the response that you get is possibly leading to better results. The kind of immune protection that we are seeing with this vaccine is like never before with any infectious diseases or viral mediated disease. And we know that it's completely it's totally protecting the severe and the severe disease and the possibility of dying if you did have COVID, as can be seen with overseas. It's a new platform and hence you get more reactogenicity, but I think it's a good thing because when we first started out, vaccine were first being designed to be made for this last year. The threshold was 50%, so anything which would offer protection more than 50% would have been licensed. And now we are talking about 90-95%.
Yes.
So that's a big win for science, I think.
Yeah, I mean, they are incredibly effective, and there's new data coming out about how effective the vaccines are, even in the last couple of weeks. So, it's really exciting. Now, we've got a question from Cindy, Angie and Christine, and this is a little bit more about risk factors for TTS, and I'll just run through them. So, and this is good. So people are really thinking about this and how it might relate to them. So do any of these conditions put you more at risk of TTS from the Astrazeneca vaccine? Varicose veins, history of stroke, high blood pressure, muscular dystrophy, mitochondrial disease, history of pneumonia or bronchiectasis, and pulmonary embolism.
Yeah, so the short answer is no to everything. And as you can imagine, if you put all of those diseases together and talk about the prevalence of those diseases in a population and the amount that have been vaccinated, and if we take countries where this vaccine is used extensively like UK and Scotland, and despite that, the chances of this TTS is extremely rare. So one good or bad thing about this is that there has been no predisposing factor that has been identified, which could then actually explain the pathophysiological mechanism. Even the HIT and cerebral venous sinus thrombosis is actually being done because that is the clinical manifestation that can happen with this rare syndrome, rather than being with true causative causality. So I guess with pre-existing, don't worry at all.
Yeah, so all of those things that Cindy, Angie and Christine have put together, they are definitely not conditions that put you more at risk. There's actually been no conditions that have been found that put you more at risk of TTS. Okay, so Kathy has a question. It's again about blood clots. This is a good question. I'm going to ask you, Mike. So if people are concerned about clots and they go to their GP to ask them questions, and what are the sorts of things they should be asking their GP to see if the vaccine is safe for them?
That's it. Well, I mean, as we've said already, there are many things which are not linked. The only two things to really talk to the GP about are cerebral sinus thrombosis. That is quite a mouthful, but that's the blood clot in the veins inside of the brain. And have they had confirmed, and that's important to be confirmed, heparin-induced thrombocytopenia. Now, as I say, these are not common conditions at all, but if you have had these things, the GP will undoubtedly have them on record.
And I'll just put that into South Australian terms.
Yeah.
That's cerebral venous sinus thrombosis. You can hear that Mike has come from the UK. And what did you
cerebral.
say? Cerebral.
Cerebral.
But everyone understood. So that's this particular clotting in the veins around the outside of the brain. So those are the two things that you might want to ask your GP, but your GP, I would think, would know if you'd had either of those things. Exactly. So now, for you, Pravin, from Debbie and Lisa, this is a really good one as well. These are all excellent questions, thank you. Is the Astrazeneca vaccine safe for people having HRT or hormone replacement therapy?
Yep. So as we've repeatedly mentioned this evening, that the only contraindication is those two rare events, which is the cerebral venous sinus thrombosis or the heparin-induced thrombocytopenia. Apart from that, you can take this vaccine if you're on HRT or you have history of blood clots, family history of blood clots, anything. It is safe at all age groups.
And you may as well keep going, Pravin, because Ian, Kelly and Marion have another question. Similar, is AstraZeneca vaccine safe for a person who has previously had thrombocytopenia? And that's a really good question because, as people will have picked up, that side effect is TTS, thrombosis with thrombocytopenia. So people want to know if you've got if you've had a past history of low platelets, is this also a problem?
So the word TTS is very interesting because this coexistence of thrombosis, which is blood clots, and paradoxically causing low platelets, which causes bleeding, is an extremely rare event. And that's how this particular condition was described initially in Norway and then, as we know, in other European countries. And that's a rare thing. So if you just had low platelets, thrombocytopenia, you are going to have bleeding problems. So you're going to have, skin bleeds or mucosal bleeds or epistaxis. Whereas if you have
nosebleeds. I'm just interpreting your medical terminology.
Yeah, sorry. I'm not good at language. Thanks, Nicola. But so when you have thrombocytopenia, which is idiopathic thrombocytopenia, you normally are predisposed to bleeding problems, not to clotting problems. So if you have history of thrombocytopenia, that does not mean anything in terms of contraindication for this particular say. If you do have low platelets, then it is same as receiving antiplatelet agents. So you will have to be careful with the injection and to apply more pressure to prevent local bruise. But the mechanisms are totally different. This is an extremely rare event that has happened, where you have blood clots and low platelets. It should be the other way around.
Yeah.
Normally.
So somebody that's had low platelets or a history of low platelets do not have to worry with AstraZeneca vaccine?
No, do not have to worry.
Right, excellent. Oh, I found a couple of questions for me now. This is a question from Michelle. And Michelle's asking, when I'm fully vaccinated, will I be able to travel interstate and back without the need to quarantine if there's an outbreak in the other state? So this is, and the next question is actually from Udi. It's very similar. When will international travel resume? So just going to whether or not we would require quarantine for people who have been vaccinated. What we're looking for in the data that's coming out of the UK in particular, but the countries where vaccine uptake has been much higher and they've got more experience now, is whether or not once people are vaccinated, are they still able to catch COVID? And if they do catch it and have the infection, can they pass it on to other people? Because if that was the case, then we would still need to quarantine people, because if our community was not vaccinated, it could still get into our community and cause a significant outbreak. So from my perspective, I'm really focused on making sure our whole community is fully vaccinated as possible. And that's probably more important than individual people being vaccinated, if you get what I mean. So that's what we say when please everyone get vaccinated so you're safe, but it's also safe for your loved ones, and it's also safer for our whole community. I just wanted to make one point on what we now know, because there is some really interesting information coming out from the UK in particular. And it looks like for both Pfizer and Astrazeneca, it's actually stopping up to 70% of people actually getting infected with the virus. And then if somebody has got infected, it's reducing transmission by about 45%, which is a lot more, I think, than I perhaps had anticipated. So not only are these vaccines that we thought were effective at the beginning of the year, I think we're actually finding out they're even more effective than what we anticipated. So it's a little bit early to say at the moment about whether you would still require quarantine or not. But the other way of looking at this, Michelle, is that once we can get more people vaccinated in both South Australia and in other states, but particularly for me it's in South Australia, particularly vulnerable people in our community, I will feel much more confident about not putting state borders down, because one of the things I really did not like doing during the pandemic was recommending having those state borders shut. It was really tough. It was, Mike and I would sit on the exemption committee and look at people who needed to travel interstate because they had loved ones and they were missing grandchildren and such like, and it's really disruptive socially and also economically. So having vaccine and having people vaccinated is definitely going to make a difference to our decision making around those state borders. Now, Udi wants to know, when will international travel resume? That's a really big question, but again, there's two parts of that. We've got to make sure we've got South Australia protected, and indeed the whole of Australia protected, and that's particularly vulnerable people, but it's also everybody, because we're all protecting each other if we can all become vaccinated. But our success will also be dependent on how much of the rest of the world's able to be vaccinated. Because if we have countries with really high rates of disease who haven't been vaccinated, and unfortunately poor India is in that situation at the moment, then it still is a risk of incursion into our country. But really our focus here is on vaccinating as many people as we possibly can in Australia. Do you think I've covered off on that? Okay with that? Okay. So hopefully Udi and Michelle, I've given you a reasonable answer. So I can't even tell you the names of the people who have asked this question, because at least 13 people wanted to know. So this question is, I want to have Pfizer, why can't I choose? Do you want to have a crack at that, or would you like me to have a go?
I think if you're on a roll, Nicola.
Okay, and then if you feel like chipping
Sure.
in, all right. So we're very lucky in Australia. Not only have we got one effective vaccine, we've got two effective vaccines. But it does make it more tricky, because people will think, oh, I can have a choice. Now, what we found out with the Astrazeneca was that we had this very rare complication of TTS. But as we've tried to explain, it is very rare. It's not related to any other medical conditions, and we do know how to treat it. So in the scheme of things, it is unfortunate, but you know, that's the facts. What we do know is that it's potentially more common in younger people. Thus, the decision to make sure that we hold that vaccine for people who are less than 50, and that was the decision of ATAGI. So, so that's the situation here. The other group, a smaller group that we have used and recommended the Pfizer vaccine over the Astrazeneca, it's not about the TTS. It's about the fact that there's only 3 weeks between doses for Pfizer. So the people that we really want to get vaccinated quickly to protect the rest of Australia are our Medi-Hotel workers and people that work at the airport in that quarantine pathway. Also people who work in our intensive care and the ED at the Royal Adelaide in particular, because those are the people that come in contact with people with COVID. And if we can protect them, and also we've offered to protect their families, and their families get vaccinated as well, that prevents, it's one of those barriers that prevents leakage of COVID out of our Medi-Hotels. And that's the reason why those people are getting it, because we need to vaccinate them very quickly because of the risk of incursion into our community. Later in the year, I'm aware that the federal government have looked at getting both more Astrazeneca and more Pfizer so that we do have good vaccination stocks in Australia. And it's potentially, it's possible that there might be more Pfizer. But that's not something I would hold out for, because we never know. With Pfizer, it's made overseas. We never know if we're actually going to get what we've asked for. And we could have an outbreak at any time in Australia. We've had 2 little mini outbreaks in WA, New South Wales last week. We're trying our hardest here to keep it in our hotels, but it is a sneaky virus. So look, really the sooner everybody can get protected, the better. And I think we are really spoiled for choice. The vaccine is voluntary, it's free, but we are sticking with the below 50s for the Pfizer in that other small group, and above 50, I'm in the age group, is AstraZeneca. Did you want to add to that?
No, I think you've made a really important point that whilst we're looking to the back end of the year to have more Pfizer arrive in Australia, there is a significant chance or risk perhaps that it may not, and that those international supplies might be interrupted. I guess in a way it might surprise people to know that I'm over 52 and have had the AstraZeneca vaccine, my first dose anyway, due my second in June.
Yeah, excellent, thank you. This is a similar question. So Anne, Sue, Cindy, Naomi, Judy and Susie asked, if more Pfizer vaccine becomes available later in the year or another type of COVID vaccine, will we have a choice of which vaccine we can receive? I really find that a bit difficult to answer just at this point in time. It's really kind of theoretical. What we do want to do is have, as I've explained, it's really important to protect people as quickly as we can. We just don't know what is going to happen with COVID. It's been very unpredictable to date with the pandemic, and I guess we'd be recommending that you get vaccinated as soon as possible with the vaccine that's been approved by ATAGI for your age group. Now, one for you, Pravin, from Anne-Marie. Now, this is a really good question. They're all excellent, but we haven't covered this one. Are there medications you should cease for a period before or after having the AstraZeneca?
Yeah, so it is a very, very good question, but a very complicated one, and I'm not going to try to attempt all the possible medications. But the only ones that we do ask you to have a discussion with your specialist or your general practitioners is if you are on any immunosuppressive medications. So there are no medications which are going to cause increased side effects or any increase in the complications or anything due to vaccine. But what we are trying to do, what we are trying to tell you to discuss with your specialist is that the timing of the immunosuppressive medications might be important, because that actually affects on the immune response to vaccine itself. So there are certain immunosuppressive medications which, if your condition is stable and you can hold off for a period of time before and after vaccine, that will lead to better immune response.
So it's about better immune response, not because it does anything with side effects?
Nothing with side effects. There's no medication which is going to cause increase in the side effects of the vaccine itself. It is so that you get the optimum response from the vaccine. So that's the discussion you need to have with your treating physician. If you're on immunosuppressive medications for your rheumatoid arthritis or multiple sclerosis or cancer chemotherapy and those kind of things, because the timing might be important in terms of the way you schedule your vaccine as well as those treatments, so as to get the optimal immune response.
Oh no, that's really clear. Thank you, Pravin. And Heather's got another question. I have high fibrinogen, which is associated with increased risk of venous thromboembolism am I more at risk of blood clots from the vaccine?
So yeah, as I've repeated lots of times this evening, thankfully there is no predisposing factor to this rare condition. And it is extremely rare, so don't worry about any of your pre-existing conditions.
Yeah, excellent, thank you. There's one for you, Mike, from Phil. Does the Astrazeneca have penicillin in it? And I'm guessing that Phil has a penicillin allergy, so wants to be sure that he's not going to have an allergic reaction.
Sure. No, it absolutely doesn't have any penicillin in it. And in terms of the constituents which might cause allergy, very standard constituents. So if you've been okay with other vaccines, you should be okay with this.
And I was down at the Wavell mass vaccination clinic today, and I could see how they'd set out the area for observation, and they had the SAS or ambulance personnel there to help assist in that area. And so it's important that anybody that's had a vaccination has a 15-minute observation period afterwards, just to make sure that any allergic reaction or anaphylaxis is picked up on and treated.
So just to add to that, actually, this was the initial fear when the first two adverse reactions were anaphylaxis, and they were thought to be related to your food or medication allergy. But I think we can be extremely reassured, and we've published on this last week as well in Jackie Now with our experiences, that don't worry if you have any history of any food, medication or a sting or venom allergy, if it is single. If you have had a documented anaphylaxis to multiple medications, so when you have history of anaphylaxis to multiple allergic reactions to multiple medications, that could be because of a common excipient. And it is the excipient to which you have allergic reaction in cases of vaccine allergies. So it is not to the component, the spike protein which is used to generate the immune response. It is the excipients which are used to stabilize the vaccines so that they can be given and delivered to the immune response.
Yeah.
So you can imagine that you worry about it only when it is a common excipient which can be used in multiple medications for stability. So for a single medication anaphylaxis or for food allergy, don't worry at all.
Okay. Oh, that's really clear. So it's only people who have had multiple allergies to multiple vaccines or multiple medications that we need to really watch carefully.
Yeah.
Okay, thank you. But everybody gets a 15 minutes of observation afterwards, regardless. Now, a question for you, Mike, from Corinne. Do the Astrazeneca doses have to be 12 weeks apart? Like, how strict do we need to stick to that? Does it matter if they are 14 or 15 weeks apart?
Well, ideally it is 12 weeks apart, anywhere ideally between 8 and 12 weeks. If you slip that by a few weeks, it's not going to affect the immune response which you have, but ideally you would hold to the 12 weeks. 14, 15 weeks should be okay. I looked at my learned colleague. So.
No, that's right. Yeah. I would rather bring it forward than backwards, though. So if you are planning something and maybe you are not going to be there at the 12-week mark, I would rather bring it forward.
So what,
to
8
10
weeks?
10 or 9 weeks rather than push it out.
Okay.
Yeah. So
Oh,
8 to 12 weeks, as you rightly say.
Okay. So try, Corinne, try not to do 14 or 15. Bring it back if you need to. Yeah. Mattia, one for you, Pravin. How long after surgery do you have to wait until you get vaccinated? Is there a recommendation?
There's no standard recommendations as such. The recommendations currently, actually, we are very lucky to be discussing this because the rest of the world, the discussion is have the vaccine first and forget about the surgery, and how you should first, be having vaccine before anything else. Even if you have an urgent surgery or, even then they are first vaccinating and then undergoing surgery, because the outcomes of people who got this COVID-19 because of hospital-acquired COVID or in those kind of high-risk situations are a lot worse, like 38% more chances of severe disease. But I guess we are lucky; we have a choice. So the discussion here is you should have it as soon as you have recovered and safe, which can be anywhere from elective surgery. You can have it next day to a week if you have had some major surgery.
Yeah, so just as soon as you're feeling better. Yeah. Okay, excellent, thank you. We are lucky here in Australia. Now, just got a couple left. This is a question from Sue. For either Pravin or Mike, how do Pfizer, AstraZeneca and Novavax, so we haven't talked about Novavax today, but those three differ in terms of effectiveness?
So the effectiveness is a very tricky term, the way we talk about effectiveness, which kept changing as the pandemic progressed. So initially, when we talked about effectiveness, it was all about the number of people who got infected versus not infected, and then the difference in the infection rate in them, which, as you can imagine, is very subjective. People who didn't get infected are the ones who will be exposed to this because they were not being put into one quarantine center and then had exposure of viruses. So what the figures that you can actually believe in more is the figures that talk about the incidence of moderate or severe COVID disease in whom you are vaccinated. And there, all three of them are performing equally.
Yeah.
Excess of 90%. Because that's a more robust data that everyone has had COVID. If they've had COVID, how many of them who were vaccinated had moderate to severe disease versus ones who were not? And that's why I don't like this efficacy of 90 to 97%.
Yeah.
You just need 2 more cases having COVID in either arm, and the percentages are thrown by about 5%. But definitively moderate to severe disease, all three of them work equally.
Yeah. No, so we are really extremely lucky that we've got not just one, but 2 in Australia now, but potentially 3 effective vaccines. We didn't think we were going to be in this situation last year when we were in the middle of, March, April, and we were having our wave, and we were doing all the old-fashioned things like going into lockdown and putting people in quarantine and such like. This is how we are going to get through this pandemic using vaccination, and we are so lucky that we've got these effective vaccines. So. Did you want to add anything to that?
I just think we're very fortunate again to be able to see the real world experience, and we've talked a bit about the UK because they have used a lot of Astrazeneca. They've had 2 main vaccines, with others having come on stream, and so a lot of this AstraZeneca experience has come from the UK. And I think what we've seen over the last months, albeit combined with the lockdown, is a really dramatic reduction in the number of daily cases, and in particular, as you say, really major reduction in severe disease and people who have unfortunately died of COVID. And we were just talking in advance of this, and I was saying it's just incredible the power of vaccines and just how they've transformed that disease in that country.
And tell us what the death rate was looking like, because it was
there were at points there were something like 45,000 cases a day. Because those cases were spread right across the community with young and old being infected, obviously the mortality, the adverse events are much more clustered, are much more felt in older people. There was something like 1,400 people a day dying of COVID and thousands in hospital. That's changed. There was still, we just had a look at the start of this, there was still 1,700 or 1,800 people yesterday in the UK who had a COVID infection, but of the number of people in recent weeks that had become infected, only 2 people had died just there. Now, clearly that's too many, but it just gives you a flavour of how dramatic the reduction's been. And I think that's just why it's, we've been so fortunate in Australia so far, and that's why, we can't just have to sort of rest on our closed borders. We have to protect ourselves because, there is virus in our state, and as you say, Nicola, it could breach the hotel at any point.
And I think what's been seen in India, where they were partway through the vaccine rollout, with just this horrific second wave, and once you get a lot of disease, the virus has a chance to replicate, and once it starts replicating quickly, it can have a mutation, get a biological advantage, and then, we're into worse tiger territory, really. So that perhaps leads into
and vaccines do protect against these variants as well.
Yeah, which is good.
So
good point.
We're talking about flattening the curve. We get vaccinated, we have a chance of crushing the curve.
We don't want a curve at all.
There's no more flattening. And at least crushing the curve in terms of the curve being present in the hospital. That would definitely happen if we all get vaccinated.
So it leads really nicely into our last question from Michelle and Andy, which is, I might answer this one, but why do people need to get the vaccine if there's no virus in the community? So we don't have any community transmission at the moment, but it was only a week ago that New South Wales told us they had a case of community transmission. Now, fortunately, because we've got really good systems in place in Australia, we are testing our Medi-Hotel workers, we've got really good quarantine. We have protected Australia from really those ravages of the pandemic. However, we can't keep the international borders shut indefinitely. We've basically, covered, bubble wrapped ourselves in a way, as has New Zealand and some of the Pacific Island nations. But eventually, we do need to have more international travel. And the only way we can do that safely is by having everybody vaccinated to protect yourself, your loved ones, but also the whole community. As I said before, we have got active cases in South Australia. People aren't so aware of them because they don't have to deal with them. But we've got 16 active cases in Tom's Court facility. Even though my team does a fantastic job in the Medi Hotel system, really doing, putting all the checks and barriers in place. We're still at risk of having an outbreak. When we look at the modelling, because we are quite unrestricted now, we're enjoying a really lovely lifestyle, having the showdown at the Adelaide Oval, 50,000 people attended. We are set up for an outbreak, so if that sneaky virus managed to get out, we could get into trouble, and I am going to feel really much more relaxed when we have everybody vaccinated in our community. It's really the way we can get to COVID normal, or post-pandemic normal, and I think you would both agree with me that that's really, we've got to use the 21st century medical knowledge and be so grateful that we've got these safe and effective vaccines. So I think that brings us to the end of our questions. I thought these were fantastic questions, and I'm very grateful for people sending them in. Just like to say to keep up to date by keeping an eye on our SA Health website. The Wavell Showgrounds open today for 50 and over for Astrazeneca, and it was great going down there today, seeing it's a really good setup. Keep an eye on the website. I know that the initial bookings got fairly quickly booked out, but the team there are very committed to opening up more spaces, so keep an eye out. The Women's and Children's Hospital also has a community AstraZeneca clinic for people 50 and up, so that's another place to look for a booking. Thank you.